Okay, so I'm going to show you a nice little test-retest outcome measure that I came up with for the big toe mobility, So all you need is a stick and a ruler on a door. So you put your big toe up against the door and make sure that the bottom of the toe is touching the floor. So it can't be off the ground like this, and it's like this, right? The other toes are touching the ground and your heel has to touch the ground as well, right? Then you're going to let your knee slide past the wall as much as it will go without letting the heel lift off. Then you're just going to use the stick, drop it down straight vertically onto the ruler, and you can measure how many centimeters you have there, right? Best to get somebody to help you with this so that you can make sure it's accurate and it's dropped straight vertically down, right? This can be used for big toe issues, for plantar fascia issues, posterior ankle impingement, plain old ankle sprains. This is an easy test-retest in the clinic for physios or podiatrists or for patients to check their progress. Normal here in Asia for people that I've been working with is about 10 centimeters to about 16 centimeters, but it's an excellent test. Having said that, there are a few limiting factors with this test. So if you have somebody with a hallux rigidus and they can't extend that toe at all, then you can't really use this test, right? So if people have mild to moderate arthritis of the big toe, then yeah, you can do this test. But if they're really hallux rigidus, you can't do this test. We're also taking into account, we're getting a lot of motion from other joints in the foot as well. So there'll be a variable degree of motion at the midfoot with individuals. So that's very variable. But some people have a lot of motion here, some people have very little. Then we're also going to get motion at the ankle joint, of course, right? So we have to take that into account as well. And lastly, then the knee joint also. So that knees over toes motion, the knee joint. If people have some knee issues or anterior knee pain, they won't want to go forward as well. So give it a try. All you need is a ruler stuck to the ground and a stick.